up to the same old fight, chasing shadows in the night. Promises made, but I let them fade. Caught in the cycle, I'm feeling betrayed. Round and round, I'm losing ground. Trying to break free, but I can't see. These negative patterns are haunting me. Nights turn to days, I'm losing my way. Thought I found peace, but it's led me astray. Chasing the high, but it only brings pain. The more I run, the less I gain.
Hey everybody, hey! Welcome to the office of another session of Tarka Say It Again. And today we have a special guest here with us in the office, and she is a licensed mental health therapist. Yes, you heard me, a licensed mental health therapist. Her name is Latoya Boyd. Now, when we talk about mental health, we know that that deals with the psychological and the emotional well-being of yourself, right? And how it is vitally important because this central location up here, it controls those actions, those manifestations. So with that being said, I'm turning it over to her so she can give us some knowledge today on mental health. Hi, ma'am.
Well, hi, Miss Tarkle. Thank you for having me today.
Yes, I definitely appreciate you coming in, taking the time out your busy schedule to speak with us today on mental health. Can you give us some background information on what you do, what that looks like?
Well, I'm a licensed mental health therapist, and like you said, mental health is very important. Mental health controls everything, the mind, the body, your health, and everything. Mental health is just as important as your physical health. A lot of times people don't realize it. When your mind goes down, your body goes down. So you're very, very right. Mental health is very, very important. So thank you for having me. I think it's a very important topic to talk about.
So, with that being said, because we know that mental health is a wide range, a lot of things fall up under that. We consider that to be like the umbrella, right, of conditions and disorders. And just in thinking about it, you know, I know that you have like mood disorders or anxieties and personality disorders and just a plethora of types that I don't even know about, right? But if we could basically hone in on at least one specific that you feel the people would definitely benefit from, if you could do that for us.
Well, I guess we'll talk about one of the most prevalent ones that people are dealing with now is depression.
Okay.
I mean, we hear about depression a lot nowadays, but I think people take depression very lightly. They use the word loosely.
Yes.
We hear people nowadays just using the word I'm depressed often. And I think it's important to realize that depression falls into two categories. Sometimes we can be depressed because of situations that we're dealing with.
Okay.
We're depressed because we lost a job. We're depressed because we're dealing with situations with our children. We're depressed regarding financial situations. Okay. And those are situations in which, you know, when things change in our life, we go back to our normal way of functioning. Sometimes people deal with depression and they don't have control over in which they're feeling. And that falls kind of in the category of clinical. I hear patients sometimes describe that they're waking up in the morning with this dark cloud hanging over their head, and it affects their ability to function.
Would you say clinical is more severe?
It does fall in the category of more severe.
Okay.
Typically, those individuals require medication management sometimes. Remember, the key word is it affects their ability to function. Sometimes it's hard to get up out the bed. It's hard to get up and start their day. Sometimes it affects their ability to work. Not necessarily that individuals that deal with circumstances where, you know, when we're dealing with financial issues, that it doesn't cause us sadness, but it doesn't necessarily affect our ability to function.
Okay.
And so I think that's the key word that I want people to kind of key in on, that it affects our ability to function.
Okay. So you've given us some background information as far as the severity, the clinical. Are you able to give us or share out What was the second one? Because you said there were two that fell up under it.
What I was describing is that there are situations that go on in people's lives.
Okay.
When they describe, I'm depressed, they use the word loosely, depressed.
Mm-hmm.
And I was describing that there are situations that go on in all of our lives that cause us to feel depressed. And that there are some individuals that are dealing with situations that affect their ability to function.
Gotcha. That's the key word.
Mm-hmm.
Okay. Function.
Yes.
So would you tie in anxiety, right? Because that's just a everyday feeling. Would you say everyday feeling that you might have that could be good or bad, as to say? Could you give us some information on that?
Anxiety.
Yes, because I know a lot of people that, it affects them to where sometimes they're unable to move forward. When we talk about or think about like performances where you have some people, they will not, the body goes to
anxious.
Right, and you see those outward manifestations to where it's like, no, they shut down completely. And then you have some, they, I guess, work with the anxiety, they get through it, and
it motivates them, basically, is what you're saying.
Because listen, you have Beyonce. I've heard her say that she gets nervous every time she go to perform, but it doesn't stop her. She goes out and she does her thing. So, like, are there, we talk about, like, is it the hormones or morphines? Like, what is that? Like, I've heard something like that before.
How would you describe anxiety? Like, if you think about the definition of anxiety to you, how would you describe anxiety?
Ooh, let's see. I would say that it's something that maybe controls my nervous system.
Okay. All right.
That's what I would say.
The definition of anxiety is the fear or worry about things in which we can't really control.
Okay. The fear or worry of something that we can't control.
Really. All right. So we get anxious, we get keyed up, we get worried about things a lot of times. And so what you're describing is sometimes people, anxiety can really, really make them nervous to the point that it can empower them. They go and they do a really good job, or they can really get so anxious that it just kind of make them maybe do a poor job.
Wow.
But when you really think about it, it starts in the cognitive, in the mind. So we can start having these thoughts that can make us go and say, okay, I'm going to go and do something really, really good. You use Beyonce. Or we can have these negative thoughts that can make us really, really get so anxious and worried. And we just start having, I call them irrational thoughts, that something really, really bad is going to happen. I have a competitive gymnast, and she's is similar to how you described Beyonce. Her anxiety make her go, she gets really, really worried right before she performs, but because she gets so anxious, it empowers her to go and do a really, really good job. Because a lot of times you have to keep thinking about, I am going to do really, really good. Because, I mean, we get worried. We're fearful, but we have to channel our thoughts in a positive way. We can channel our thoughts in a negative way, or we can channel our thoughts in a positive way. So it's almost like when we get anxious, we have to replace those negative thoughts with positive thoughts.
Exactly.
And so typically what we have to do when we're dealing with something like anxiety is that we have to replace the negative thinking with positive thoughts.
Okay. And that's important because, like you just said, you hear, or it starts in the mind, your thoughts. So yes, just reiterating and telling yourself, like those affirmations, to tell yourself those positive things. I can do it. I can do it. I will do it. I will do it.
And when you think about a lot of times with things like what we've just talked about, we've only touched on 2 topics in terms of mental health, depression and anxiety. A lot of times coping skills are key. Sometimes we have to do medication management in addition to coping skills. But a lot of times coping skills is key. We have to be intentional about our mental health. And one of the things with coping skills, a lot of it starts with the cognitive, is our thought process and how we deal with certain situations. Certain situations that we deal with that causes us to feel depressed. How do we deal when we're in those dark places? A dark place of when we lost our job. What do we do when we're in that moment? What do we do when we're extremely anxious about certain things?
Mm-hmm.
Are we allowing our thought process? Are we allowing our situations to take us deeper in that darker place? Or are we being intentional about doing things to help us to come out of it?
Mm-hmm.
And those are the important things that we have to realize. Some people turn to positive coping skills, and some of those positive coping skills are maybe walking, our faith-based organizations, being around our positive support system.
Mm-hmm.
Some people turn to negative coping skills.
Mm-hmm.
Those negative coping skills may look like
drugs,
alcohol.
Mm-hmm.
You know, another negative coping skills is attaching to negative people to make us feel better about our situations.
Wow.
And so we have to all be aware and cautious of the things that we do when we're in those places that are very uncomfortable for us.
Right, right. And I like that you're sharing those coping skills, because I know with addictive patterns, I always talk about some of those coping skills or strategies, you might say. And one of the things I tell the people, first, you need to identify that there's a problem.
Mm-hmm.
Then the next one is reaching out, like you mentioned, the support system, reaching out to a professional such as yourself, you know, someone, it could be a trusting adult, you know, if we're talking to a child or a teenager or someone like that. And then lastly, those triggers, like trying to remove yourself from that situation, you know. So I found that, like, what's the word I'm looking for? I guess you would say universal. When we talk about addictive patterns, and I think triggers, because it could put you back into that same situation or mood. So I think that's important also, because, you know, you might seek help, but then you go back to the same thing that got you there. So, yeah.
I think that's a very important point that you brought up, because that's something that we talk about a lot in therapy, is identifying your triggers. Before you can develop healthy coping skills, you have to identify your triggers. You identify your triggers, and then you develop the helping coping skills to help you to deal with those triggers. So that's very, very important.
Love it.
I remember when I came to your book, what was
launch,
the book launch, and we talked about addictive patterns, and that addictive patterns could be, what was the term that you told?
Oh, it could be hereditary, it could be learned behaviors, and it could also be generational curses, or a softer term, generational habits.
It was something that you told me that your father had told you.
Oh,
it could be good or bad, right?
Yeah, addictive patterns could be positive or negative. Yes.
Yeah.
Exactly. And that's something in dealing with that topic. It's like we've been finding out just more and more information, and literally seeing how every facet of life points back or connect to addictive patterns. Because a lot of time people hear it and it's like, oh, you know, but no, it's some positive things out there, just like we just talked about anxiety. It can be positive as well. And that's what you want to do. Identify which one it is. And if you see yourself doing more of the negative, let's try to make some changes. Let's try to replace some of those negatives with positives, you know, because basically it'll help the generation thereafter, you know.
I pointed that out because I wanted to make sure that I brought this up, is that when people think in terms of mental health, they often really want to go to the extreme, which prevents them from getting the support that they need. They often think that mental health involves really, really severe disorders. Your mental health can be simple. We have to be intentional about our mental health. You talk a lot about addictive patterns can be good or positive. Guys, we have to understand that mental health falls in the category of simply being stressed out, being overworked, just sometimes just not being intentional about our care, not taking time to balance our life. And so we have to make sure that we're doing everything possible to make sure that those things are in order, so that we do not become depressed, so that we do not become anxious, so that we do not develop more severe mental health disorders. So it starts with us being intentional about taking care of ourselves and our mental health so that it does not develop into more severe issues for us. It's the same as our physical health. They encourage us to take care of our physical health so we don't develop more intense physical issues, correct? The same concept.
I love it. I love it.
Same concept. And I think that it prevents people from going to see a therapist to talk about simple issues in their life because they feel like in order for them to come see a therapist, they have to have some very severe mental health disorders.
Wow.
And that's not true. And I think that's a stigma attached to mental health. And I think it really prevents people in our culture from coming to seek out mental health and seek out coming to get support. And I really want people to not do that.
And I think it also could hinder us as well as far as moving forward with things in our lives. You know, when we talk about being like the head of the household and you mentioning the self-care, how that's vitally important because we have to take care of ourselves first in order to take care of those that we're taking care of, like our children or our significant other, those that are in our lives that's under our care. We got to take care of us first in order to pour anything back into them. If not, we're going to find ourselves, as you say, that vicious cycle, just like the rat race, just going round and round and round. So.
You're absolutely right. People need to have balance. Keyword balance. We need balance in our life in order to be able to finish this race called life.
That's it. I love it. This race called life. Well, we are ending our session for today on mental health. And I know because I know you got something out of today's session with mental health and how it doesn't have to be severe in order for you to reach out or seek a counselor or a therapist. You can just seek them out to get order or balance in your life. And that is it. Please check us out. Please like and subscribe on YouTube or Spotify. Go to addictivepatterns.com for our website. And if you want to follow us on Instagram, again, Addictive Patterns. Thank you.
No problem. I appreciate you for having me.
Yes. All righty. Have a good one. Highlight the important things for your mental health. Exercise for 1 hour. Eat something healthy. Drink a full glass of water. Practice deep breathing. Take a bath or long shower. Make sure to wear comfortable and clean clothes. Take out trash or recycle. Clean up messes and do dishes. Read a book for 30 minutes. Go for a walk outside. Play with a pet at home. Watch a show or movie you love. Call a family member. Call a friend or partner. Journal your feelings or draw pictures of them.